1924, our founders had a singular thought: to save people with heart disease. With a bold vision and audacious goals, they set out on a mission that would change the world. Working alongside a global family of volunteers, donors, and advocates, we have transformed the way the world understands, treats, and prevents cardiovascular disease and stroke. We've advocated for the rights of patients and their families, and we funded scientific research that has saved millions of lives. There are so many incredible achievements to celebrate, and yet we're not stopping there. In fact, we're just getting started. As we celebrate our 100th birthday, we're partnering with you to bring our Centennial to life in ways that get even more people excited and engaged about our mission. From heart walks in Cycle Nation to the glitz and glamour of heart balls to companies in schools and community events, we're celebrating how much we've achieved together and all the bold hearts that make it possible. We're expressing our gratitude to our donors and community partners who fuel our mission and casting an even bolder vision for our future as we together continue to fuel science and innovation, fund life-saving research, and make a difference in communities that need us most. 2024 is going to be an unforgettable year as we say to the world, our future is about improving yours. Join us on the journey.
Welcome, everyone, to today's American Heart Association Centennial webinar, sponsored together by Bronson Healthcare and Ascension Borges. I'm American Heart Association West Michigan Executive Director Jana Szyminski. In 1924, 6 physicians gathered to form the American Heart Association as a scientific society to prevent and treat heart disease. 2024 marks our official founding, when at a meeting in Chicago, the association elected its board of directors and officers. In the century that followed, we have dedicated our mission to advance health and hope for everyone, everywhere. I'd like to take a moment to share some major milestones that took place in the first few decades of our history. These milestones have positively altered the course of human history and have saved millions of lives from early death and disability due to cardiovascular disease. The first is 1921, which marks the first year that heart disease becomes the #1 killer of Americans. It's no coincidence that this date, combined with the sudden rise in deaths from heart disease, caught the attention of cardiologists and inspired a passionate commitment to found the American Heart Association just 3 years later. The following year, the American Heart Association held its first scientific sessions meeting, a gathering that became the largest annual cardiovascular meeting in the United States and a leading international destination for the cardiovascular health community. In 1925, it was also when the first American Heart Association journal was published, so that cardiologists and other medical professionals could share research. In 1926, the American Heart Association approved the criteria for detecting heart disease so that physicians around the country were using the same standards of measurement and care. And in 1927, we published the first heart disease mortality statistics to raise awareness among the medical community on the impact of heart disease. The next date I'd like to point out is 1947. This was the first time the American Heart Association decided to reach out to our nation and ask for support through the first Heart Fund campaign, and the people responded. And from their support, we funded our first research grant for Dr. Albert Sengerjai, a 1937 Nobel Prize winner. His work studied the energy that muscles, such as the heart, need to contract. In all, the association has funded 15 Nobel Prize winners, including 10 whose AHA-funded work led to the Nobel Prize. Thanks to the ongoing support from the Heart Fund campaign, the American Heart Association was able to fund research that has led to medications that lower blood pressure, the first pacemaker being implanted, the first CPR training to acquaint physicians with closed chest cardiac resuscitation, the first mechanical heart valve, the first cholesterol-lowering drug, and much more. Since the American Heart Association's founding in 1924, deaths from cardiovascular disease have been cut in half. Similarly, the American Stroke Association was formed in 1998, and since that time, we have seen a 31% drop in age-adjusted deaths from stroke. This success is because of the bold commitments of our researchers, medical experts, volunteers, donors, and supporters. During today's webinar, we'll hear from some of those supporters, volunteers, and medical experts we're working with here in West Michigan to save lives in our next century. In the meantime, a representative from the American Heart Association will be monitoring the chat for any questions or comments you may have, or to connect you with additional resources. Let's get started.
Hello, I'm Bill Mantz, President and CEO of Bronson Healthcare. And on behalf of Bronson, we are proud to sponsor today's Centennial webinar. And we're thrilled to walk alongside our partners at the American Heart Association as we celebrate the centennial year and continue our focus on saving lives and advancing the health of our communities. Now, cardiovascular disease claims the lives of 1 in 3 people in the US every year. And every one of you watching are in some way helping healthcare providers combat that statistic in Southwest Michigan. You're doing this through your awareness of the warning signs of cardiovascular disease, and you're doing this through your support for the American Heart Association's research and educational outreach. Now, prevention through lifestyle changes like eating better, knowing your blood pressure numbers, and getting enough sleep are key. But there are times when treatment is needed. And we're fortunate in Southwest Michigan to be able to provide patients the life-saving care that they need. Now, in 2023, Bronson was recognized by the American Heart Association as participants in the American Heart Association's Get With the Guidelines initiative. This initiative aims to improve the outcomes for Americans who experience heart disease or stroke. Our colleagues at Ascension Borges were also recognized with this honor. Now, while we've made great strides in cardiovascular health equity remains at the core of our mission. We know that women, minority populations, and those from lower income or rural neighborhoods are disproportionately impacted by heart disease and stroke. Going forward, we need to partner and embrace this challenge because together we must continue to educate and advocate for people from all backgrounds to build healthy lives in our community. So no matter where patients receive care, we know that there's power in collaboration, there's power in connection, and when our communities come together to achieve exponential impact, we can do virtually anything. We're in this together, and while we're celebrating the American Heart Association's 100 years of life-saving impact, we know that we're not done yet. We must continue to support each other and support those who are at risk in our community. Thank you.
The call got toned out on our radio. I heard there was a cardiac arrest, and I knew that we were pretty close by.
He's like slumped over on the steps, and I ran, and I got the guys to lay him flat, and he was not breathing.
It's a scary situation. My friends were brave. Right after that, our chief arrived with our medical unit and the AED. We placed the AED on, and it immediately said shock advised, and so we administered shock. I was completely helpless. I needed people
to help me, and it makes all the difference in the world.
It's a miracle. It's amazing to me. All of these first responders here today, it's God sent to know them and to be able to reunite with them.
I can't overstate how important bystander CPR is.
This stay alive thing, it's a team sport. We have to do it together, right?
Learn CPR. It saves lives.
I'm active, I'm, outdoors, so I don't know how to prevent it. Anything that's not right or feels weird. Pay attention to, different things, or, with the facial expressions or that sort of thing. Anybody can have it, so, I think the awareness, it's a matter of life or death. If you're not sure of what somebody is going through, you ask them a question. I am a stroke survivor. Thanks to the American Heart Association's advancements in research, I am here today.
Some of those stories were really quite incredible, how someone had gone from having really significant symptoms and acquired an awful lot of disability, and through the research that we've been able to do, much of it funded by the American Heart Association, we were able to use new tools that we have available that returned function. I mean, literally within the course of hours, returned this person's function that they had lost related to the stroke. And so some really incredible stories that we got to hear, and some incredible outcomes. And that's just a fraction of what we get to see every single day, and so that was really the purpose behind that meeting, is celebrating some of those great outcomes we've had, and working on funding the next big breakthroughs. Keys that I think that we have been able to come up with that have expanded our tool set in terms of being able to treat people with stroke. Again, as we've talked about, really come down to identifying strokes early. The faster that we can get to people who are experiencing a stroke, the better their outcome is likely to be. As we know, because of that speed, a lot of our focus has been on how do we better identify these people early on. And it's gone so far as to reach out into the community, and we've partnered with our EMS personnel, and we're working on funding several different research studies that are utilizing different tools like EEG and accelerometry data for the head to better identify when someone's having a stroke early on. And so out in the field, then our EMS colleagues can call us up and say, hey, it looks like I got somebody that's experiencing a stroke, and we're available right there for when the patient arrives. So we can immediately start to treat them. We have a heads up before they even get there. And so those are just some of the things that have come about recently that have helped us expand our capabilities. The tools that we utilize and what we call endovascular treatment. So the ability to use a catheter to go up and pull up larger clots when someone is having a stroke, just keep expanding. It seems like every few months there's a new catheter available. It seems to be doing better than the last catheter. And so all of these things we put together and we utilize to ultimately come to a better outcome for our patients. Really truly makes a difference. There are certain previously marginalized groups within our community that did not receive the same sort of outpatient care and preventative care that they should have, and so they're at a higher risk for developing some of these more acute problems that we deal with and we see. And so it's not only about treating those more acute problems, but how do we better reach those people and provide better preventative care so that these issues don't become problems in the first place. And so it is a core tenet of our entire group working on that.
Hi, everybody. My name is Nishtha Sareen. I'm an interventional cardiologist with Ascension Medical Group, and I direct the Women Heart Program for Ascension, Michigan. It is my absolute pleasure to talk to you about heart disease in women and what we should know. We partner with American Heart Association in their critical role in research and supporting this cause. Heart disease is the biggest killer of women in the United States. It's a bigger killer than breast cancer. It's a bigger killer than all cancers combined. It kills most women in all age groups, including the young women who are pregnant. It's important to understand the risk factors of heart attack and what the signs and symptoms are. The signs and symptoms are very different in men and women. It may not be chest pain, chest pressure, going to your jaw, going to the arm, going to the back. It could just feel like feeling tired, dizzy, having palpitations, just not feeling right. If you think you're having a heart attack, call 911 because we only have 90 minutes to save that heart. It's important to know that more than 50% of deaths that occur because of high blood pressure occur in women. It's important to know your numbers. It's important to know your statistics. If you think you are at risk or have family history of heart disease, please make sure you get checked. Remember, risk factors in women can also be different compared to men. Not just diabetes or hypertension matters, but also having eclampsia, preeclampsia during pregnancy increases the risk of heart disease by 25%. Having menopause, hysterectomy increases the risk of heart disease. Having more than 3 children increases the risk by almost 30%. So be aware, be passionate, and advocate for yourself.
Happy 100th AHA.
Happy 100th AHA.
Happy 100th AHA.
Happy 100th birthday to the American Heart Association.
American Heart Association. Happy 100 years.
Happy 100 years, American Heart Association.
Congratulations, AHA.
American Heart Association, congratulations.
Happy 100 AHA.
AHA, here's to 100 more.
It's our 100th birthday, and it's our mission to make our future about improving yours. We're bringing our mission to life by making this American Heart Month our biggest and most important one ever, with countless opportunities to help save lives.
Someone who can save a life, that's a superpower if you ask me.
We're celebrating all the bold hearts who have made an impact in saving lives through CPR, while relentlessly joining hands with our supporters, volunteers, donors, and members to pursue our bold goal of doubling the lives saved from cardiac arrest.
Without the American Heart Association, I probably wouldn't be here today.
If it wasn't for CPR, I actually wouldn't be alive today.
Be ready.
Be ready.
Be ready. Be ready.
Our birthday wish is for every family, child, neighbor, and community to learn CPR and join the nation of lifesavers so we can build a brighter future for all.
Wow, this Heart Month was a Heart Month like no other, and was headlined by our Kalamazoo Go Red for Women Gala. The signature fundraising event held February 8th raised over $700,000 this year to advance heart health right here in our community. I'm American Heart Association Development Director for Southwest Michigan, Logan Poley. And as we celebrate our 100th anniversary this year, we were thrilled to share the incredible gala experience with you. Our amazing chair, Aaron Vischer, and our incredible honorary chair, Barbara Parfit, had a bold vision to go big, and we saw it come alive that night.
We achieved that $100,000 goal in the room tonight.
For 2 decades, Go Red for Women has been saving and improving women's lives by advancing equitable research and care, advocating for inclusive health policies, and educating and empowering women on how they can take control of their health. Together with everyone who joined us in Kalamazoo, we are standing up for women across Southwest Michigan to help ensure all women have an opportunity to live a long and healthy life. We believe everyone should have the same opportunity to be healthy and happy, and we're working to make that happen in our homes, neighborhoods, and businesses. We came together to celebrate what the Go Red for Women movement has achieved in our community and look to the future for what we can continue to accomplish. This year, more than ever, our community is coming together, and we are so fortunate to have 2 award-winning health systems in our community, both walking together with us into our 2nd century.
People who care so deeply for the health of our community, for the health of our women, and to support such a fantastic organization. So thanks to all of you for coming tonight.
And on behalf of the Bronson Healthcare Group, we're thrilled to walk alongside the American Heart Association as we celebrate this centennial year and continue to focus on saving lives and advancing the health of our communities.
Because of our donor support, we have been able to implement blood pressure management programs at local organizations like Ascension Borges and the YWCA, and conduct CPR education by providing resources for organizations such as Bronson's Newborn ICU and Cradle Kalamazoo. I'd like to thank Ascension Borges and Bronson Healthcare for sharing their support of our mission. And a special thank you to Dr. Serene and to Dr. Morgan for sharing the impact our work is having on their work and ultimately on the patients that they treat. All of our sponsors and their shared commitment to our second century vision of advancing health and hope for everyone everywhere. We thank you from the bottom of our hearts for your immense generosity. The Kalamazoo Go Red for Women Gala was a historic evening, and we could not have done it without you.
As we continue to gather more and more information, and in some ways, this almost creates more and more questions. So as we start to answer one question, we develop more and more questions. And so, yes, the expansion in terms of the knowledge and the research that we need to do is just going to continue to grow. And so continuing to fund those advancements are absolutely key to be able to have these treatments available, to be able to take care of our community members, right? And so, you know, I live in this community, I have family in this community, and I want them to receive the very best care as though they're at the very best center anywhere in the country. I want them to receive the exact same care. And that's what we're able to do by taking some of these tools and with all of this research and the support from the American Heart Association, our ability to expand what we can offer right here and take really excellent care of our own community.
We are very excited to partner with American Heart Association as we enter the next century. Remember, when a woman dies, a family is lost. But when a young mother dies, a generation is lost. The impact that the research and the efforts are having are significant and magnificent. And we wish American Heart Association the very best in continuing to make that meaningful impact on our society.
Hello, Michiganders. I'm American Heart Association CEO Nancy Brown. As a Michigan native, I'm incredibly proud of the work we're doing in my home state and the historic role we've played in advancing heart health globally. As we celebrate our organization's 100th birthday this year, I want to extend a heartfelt personal thank you to all of you for your support in making this milestone possible. Your donor dollars, your volunteer efforts, and your commitment to helping educate our community are helping us be a relentless force for a world of longer, healthier lives. AHA's history has deep roots in the mitten. The first mechanical heart was developed in Michigan in 1952, and the electrocardiogram and the use of thrombolytic therapies were both pioneered here. More recently, we've trained over 280,000 Michiganders in the life-saving skills of hands-only CPR during this past year alone. And your support of the association is helping to fund 109 research studies totaling more than $24 million at Michigan universities. I'll share two stories that demonstrate the personal impact of your support on your neighbors across the state. Jeff Brazda in Kalamazoo and Bishop Edgar Van in Detroit. Both are survivors thanks to you. Jeff went into cardiac arrest on the pickleball court, but is alive today thanks to the quick actions of his wife Kathleen, who immediately began performing CPR, and the quick response of paramedics. Bishop Van went into cardiac arrest while on the pulpit, but because his congregation had a cardiac emergency response plan in place, the church's medical team jumped into action and saved his life. As AHA champions, Jeff and Bishop Van are two of the many reasons our statewide efforts to turn bystanders into lifesavers and to make cardiac emergency response plans mandatory are so important. Michiganders, our future is about improving yours, but we can't do it alone. With your donation, with your time, and with your voice, we have the opportunity to advance health and hope for everyone, everywhere. Thank you from the bottom of my heart.
I just feel like I've been given a new lease on life, and this is something that I will never ever take for granted. And I just hope there's never a day that I'm not here with them. She still sleeps in a bedside bassinet in our room, and I literally lay awake at night and just listen to both sides of me, listen to my husband and daughter breathe at night. thankful to be able to do that. The awareness has to continue, it has to spread. People have to be made more aware of how serious this is. I feel so naive because so many people in my family have been affected by heart disease. We've lost so many people in my family to heart disease. I'm really ashamed that it took this for me to realize how important heart health knowledge is. I really feel that she has a lot to do with me making it back, you know? I think the love between a mother and a child is really powerful. You know, I always looked ahead towards 50 and 60 and 80 and thought about what my life was gonna be like then, and now I'm, you know, looking forward to next week and next month and next year, and I hope there's never a day that I'm not here with them.
It can really happen to anyone. For me, there was no cause, and I guess that's still concerning, but I learned that it can happen to anyone and that there was no reason that it happened to me. I didn't take a step back on basketball. Like, obviously I worried at the start, will it happen during when I play basketball, but it happened at rest. So that motivated me to play basketball again, and obviously I want to play football again too.
When he got in the game the first time, I mean, I of course had tears in my eyes, and then he scored a basket and it was a standing, I mean, he came in and to a standing ovation, scored a basket, standing ovation. And then the very last game, he decided the last game he was gonna dunk, and he did.
Before my cardiac arrest, I had no idea who the American Heart Association even was or what they did. But now that I do, I mean, I respect them a lot. They provide CPR and videos, and I don't know where I would be without CPR and my dad knowing CPR.
Continue to spread the mission. There's people who have given their lives to doing the research, and they want to continue to be on the cutting edge. But those funds have to come from somewhere. I mean, Jake, someone funded the research to give him his ICD, and that is the only reason that I can sleep at night.
Welcome back. 1924 began a bold commitment from our founders in response to the sudden rise in deaths from heart disease. 1947 began a bold commitment from our funders so that the American Heart Association could begin investing into research to cure heart disease. And in 2024, we are asking for a bold commitment from all our supporters as we face new cardiovascular disease challenges into our second century. New data released this January through the American Heart Association statistical update shows that the sudden increase in cardiovascular disease deaths due to the pandemic continued in 2021. In 2021, more people died from cardiovascular disease than any year since 2003. It's the highest death rate in 18 years, surpassing the number of deaths we saw in 2020. The increase in deaths can be attributed to the direct impacts of COVID-19, as well as indirect impacts, such as people being reluctant to seek medical care, stress, and disruptions in everyday life. Thankfully, 2021 data shows much less a spike in the number of deaths compared to the year before, which may be an indication that increases in deaths may plateau soon. The 2024 statistical update also shows us that on average, someone dies of cardiovascular disease in the United States every 34 seconds. That's more than 2,500 deaths every single day. In addition, someone dies of a stroke in the US every 3 minutes and 14 seconds, which is nearly 450 deaths from stroke every day. And nearly half of US adults have high blood pressure, and many don't even know it. A 2023 Harris Poll survey conducted on behalf of the American Heart Association shows 51% of respondents did not identify heart disease as the leading cause of death in the United States, despite it being our #1 killer for a century. This is why we must continue to fight. The new data also shows us only 1 in 4 American adults meet the recommended physical activity guidelines. Less than 10% of American adults eat enough healthy whole grains, fruit, and vegetables each day. And lack of sleep each night for adults is associated with a higher risk of cardiovascular disease. For every hour decrease in sleep below 7 hours, your risk of cardiovascular disease increases 6%. And for every hour increase above 8 hours each night, your cardiovascular risk increases 12%. When we look at smoking and vaping rates in the United States, we continue to see adults and teens continuing to vape. Both vaping and smoking by teens and adults is linked to an increase in cardiovascular disease. Based on the newest data, we know 1 in 8 men and 1 in 10 women in the United States are still smokers. We're also seeing a rise in teen e-cigarette use, with 1 in 7 using in the past 30 days. This is why, with bold hearts, we forge ahead into our second century, fueling science and innovation, funding life-saving research, and boldly standing for the right of patients and caregivers to empower healthier communities where we live, work, and play. Our vision for our second century means we will continue to be a catalyst for impact. We will utilize breakthroughs in science and technology, change policies and systems for better health outcomes, and transform communities. We will leverage our brand, science, and grassroots efforts to accelerate impact. We will listen and adapt to trends and disruptors that come at increasing speed. We will meet patients where they are by continuing to improve equitable health outcomes. Together, we will architect the future of health and ensure longer, healthier lives for all. Our relentless pursuit will continue until heart disease and stroke are stories of the past and not of our future. And you can help by visiting heart.org/Michigan to make a donation or get involved. Thank you again to our sponsors of today's webinar, Bronson Healthcare and Ascension Borges. And thank you for joining us to save lives in our second century.
We spend every day helping to protect hearts, protect brains, and we do it with passion, with purpose, in a people-centered way.
The American Heart Association is dedicated and committed to addressing the major health problem in our society, and that is death and disability from cardiovascular disease and stroke.
If you look to your right and you look to your left, and you look in yourself as well, you're going to see someone who is going to die from heart disease. And because of that, I think that you really should support the efforts of the American Heart Association.
There is tremendous amount of work and opportunity for us to educate, develop technologies, eliminate and to reduce heart disease and stroke.
I hope you will consider joining me and other ardent AHA supporters across the country as we band together during this 100-year celebration.
We like to envision this next century as the century of biology, of data, and I'd like to add to that the century of equity.
The AHA has made a tremendous impact on advancing all knowledge of heart and brain health, with the goal of providing every person the chance for a full, healthy life.
The Heart Association has always had that partnership among the public, patients, and among the healthcare providers, realizing that an informed public is necessary for the public health.
Advocacy or educating the public, the AHA is at the forefront.
We can carry on the mission of the American Heart Association, whether it's in rural or urban communities, to deliver the best care to those who need it.
And we continue to take a scientific approach and use our resources to inform new knowledge. We can't miss, we can't fail.
That's why people should stand with the American Heart Association in our next 100 years.